Thank you, Ian. And I invite all those people listening to please submit questions in Slido, and we'll incorporate them shortly into the discussion. Now I'll share a few thoughts reflecting on what we've heard and give you a bit more context to myself. So by way of introduction, I'm Bob Kocher. I'm a partner at a venture capital firm called Venrock. Venrock invests in all kinds of tech and all kinds of healthcare at all stages. And before coming to Venrock, I worked in the government in the United States, in the Obama administration, on the Affordable Care Act, on the National Economic Council. I did a bunch of work on health IT and getting doctors and hospitals in America to use computers and then share the data. Worked on childhood nutrition with the First Lady on the Let's Move program and oversaw the FDA and Medicare. Before that, I was a partner at McKinsey, where I worked all around the world with health systems and hospitals and regulators on health policy and on healthcare quality and healthcare economics. And I'm trained as an internal medicine doctor in Boston at the Bethesda Deaconess Medical Center. So a lot of my perspectives come from being a doctor. And today I'm on faculty at Stanford in the School of Medicine, where I teach entrepreneurship and healthcare policy, and in the business school. And I'm a senior fellow at USC. What I guess I would say first is I love to invest, as Ian said, in great people. But at the end of the day, we want to invest in great businesses. Anybody who gives you money outside of government grants is hoping that that money is given back to them, and a lot more actually is what they're hoping for. And the people who are giving you grants are really hoping that that money goes to something that will last into the world, like that will persist, that will help people. And so I want to talk to you a bit about what makes a really great business, because fascinatingly to me, it is the same whether you're starting a restaurant, a software company, a biotech business, or a healthcare services business. There's just a handful of things that define a business and whether or not it's a good business. And so I'll share those with you. Every single venture capitalist is going to be thinking about these questions. Ian has them in his head every time you start talking. So the first one is, how much does it cost you to get a customer who will pay you money? In all cases, you need to get paid to do the thing. And if you haven't figured out who's going to pay you and why they're going to pay you, and why the price is worth it, and that price has to be defined by you give them more value than you're charging them. Like who will pay you and how much does it cost you to find them? Often, the hardest part of a business is finding someone to pay you money. Advertising on the internet is not cheap, it is expensive. Advertising by mail or TV or radio or billboards, it's expensive. Going to have meetings with someone many, many times to explain to them why they should pay you is time-consuming and expensive. So it's called CAC, customer acquisition cost, is the first thing you have to overcome. It's like an asteroid that could crush you. The second thing is, how long will they pay you and how much money? And so being paid once is awesome if it's a lot of money, but it's not awesome if it's not a lot. So that's why you see so many businesses that want you to pay for recurring revenue, sort of a subscription type business where you renew it every single year and need it for a very, very long time. That means that there's a lot of money to pay for getting the customers. It is frequently the case when you're trying to sell things to consumers, they don't have much money. And so they can't pay very much, and it costs you a lot to find them. And that doesn't work. It's a broken business. The third thing is churn. And that's how often do people fire you or stop paying you or find something different, or is the need gone? And of course, if you have high churn, you have to keep replacing everybody you lose with more people on the front end to grow the company. And that's sort of like a treadmill that's really hard to stay on. It keeps speeding up. So high churn's a problem. The next thing is the gross margins, or how profitable is the business or service. And a lot of businesses or services, you need a lot of people to do things. And that's why they're great, is you hire wonderful people who deliver really specialized expertise to people, and it makes their lives better. But those people are expensive. And so you try to use software to make them more efficient. But if you have a lot of people delivering a service, you have to cover that cost. So it makes the price relatively high, or your margins are very, very low. In healthcare in the US, you'll see that hospitals and insurance companies, because they have a lot of people, have very low margins, somewhere between 0 and 10% in most cases. Now, a drug, for instance, will have very high margins because there's not a lot of people after that thing is created going into the delivery of the product. And so they can have 80, 90% gross margins. And those margins really shape how valuable the company will be. The last thing is, how big is the market? So you'll hear the term TAM, total addressable market. And that comes down to sort of how many people want to buy the product and how much will they pay. It's sort of that math. In healthcare, while healthcare is an enormous part of the global economy, and in the US, 22% of our economy, it's actually thousands of small markets. You can think about every disease at every stage. There may not be many people in it. Now, that's why drugs for some of those segments cost a lot of money. That's how they have a big enough TAM to build a company. A drug might cost $100,000 or even $1 million. That's also why drugs for very large populations will be cheaper, because you don't have to charge as much per person to have a large TAM. But it's these basic things that go into how valuable a business is. You can compare a biotech company to a software company to a consumer company across these dimensions. And when you look at how companies are valued, it's literally math on these basic dimensions. So how much is your CAC relative to your ARR and churn and gross margins? How big is the TAM? And then how fast is it growing? And that's how a venture capitalist decides what your valuation is. And more importantly, after I give you money, it's how we determine how big the business becomes, is sort of those basic metrics. I'd encourage you to think about them. While it may not be as intellectually as exciting as the invention of the technology or your imagination for like what it can do in 10 years, if you don't actually have these metrics working at the beginning, you won't get the money to start the business. Because no matter how much we say we're long-term focused and we love changing the world, we actually are trying to invest in great businesses. And the money that we give you is competing against every other company that gets funded in the world. Capital flows to the highest returns. And so you have to persuade us not just that you're compelling, but that you have a great business. If you do, you will get capital from good people. If you can't, you will struggle to raise capital. And while there are wonderful ways to sort of do the very early R&D, almost all businesses need actual capital, like venture capital, to grow. The only way you have enough money to build the team and go execute is usually to raise not $50,000, but millions of dollars from people who give you money. And the way we think about who gets it is on those basic dimensions. So I'd encourage you to make sure that you think about those factors and persuade the person like why giving you money not only is good for the world, but also generates a lot more capital back. And that will be the subtext to all of your conversations on raising money at all stages. People are lovely, but they're looking for returns.